Hi, I am Osman. I am an energy healer. I'm on a master level with telepathic capabilities. I specialize in critical care recovery and terminal illnesses. I'm also capable of course, healing a host of other physiological, psychological, and spiritual ailments. And I'm also an advanced level yoga and meditation teacher. Visit my website yogawellness786.com for more information on my services. Also, remember my therapies are all natural based and not a replacement for medical treatment. The difficulty of healing neuropathy. So, as an energy healer, I can heal so many illnesses. I would say more than 90% of the illnesses that are, uh, you know, um, even difficult to heal, uh, you know, um, by other methods, and not that they're impossible, just it's extremely difficult. And one of the most or highly difficult um, things to heal is nerve damage or neuropathy. And this is common, especially in advanced level diabetes, where people are having peripheral neuropathy and erectile dysfunction. And when someone suffers with erectile dysfunction from diabetes related complications, it's usually due to blood flow as well as nerve damage. So to reverse blood flow problems and nerve damage, I would say to reversing the blood flow problem is easier, but it cannot happen only through healing, right? Energy healing will help to boost your body into self-healing mode, and the problem of the circulation is blockages in physical blockages inside your blood vessels, and this requires a change in your lifestyle as well. So lifestyle changes is more important than the healing, when it comes to improving your blood flow. And this is critical in the neuropathy, because due to the lack of blood flow as well as a major contributing factor, it also contributes towards the deterioration of the nerves or the damage to the nerves, right? Not the only cause. So, importantly, in recovering the nerves, it requires that the patient also dramatically and drastically change his lifestyle until his nerves are completely healed, and maintain some level of that dramatic change for the rest of his life, right? So, in treating one of my patients with peripheral neuropathy and erectile dysfunction, they had to also, change their diet, because healing alone, no matter how intense it is, was not working, right? It was having, a lot of improvement. Yes, there is improvement, in much of the neuropathy, but not 100% improvement, right? So, for complete recovery, and of course, if someone is suffering with erectile dysfunction, this is a major problem, especially as an adult and is in a relationship or is married. That has a tremendous negative effect, on the relationship, and also it could be on a level where even the um, available pharmaceutical interventions, like Viagra and Cialis and all that, and Levitra, does not work, right? They cannot always work, and they're not a treatment that is 100% remedy in 100% cases, right? In advanced levels, it will not work, right? So it requires a healing therapy. And yes, so with neuropathy, also the to understand the healing process, Neurologists state that it is something that when it heals, it is a very slow process. It Your nerves can heal an average of 1 centimeter per month, and you've got miles and miles of nerves in your body, right? And healing just 1 centimeter per month is a very slow process, right? And you will only notice when you made lifestyle changes, especially to your activities and your diet, the necessary changes. Then you'll start noticing very small improvements every 3 months. That's how you know your nerves is repairing. And it may take 2 to 5 years to completely heal. So depending how severe the damage is, means it can take up to 5 years to completely reverse, right? And this is a very slow process, but you can speed it up following the guidance of medical specialists, as well as natural healers like ourselves. And you have to use a combination, right? You cannot neglect medical intervention. And I always prefer avoiding invasive therapies, where people are going to operate and cut into into you in order to activate or introduce therapies. So because I prefer not to cut into the body, right? That's my preference in myself, and prefer resorting to natural methods. And if it not working completely, and I really want to involve this type of invasive therapy, and I have to understand the risks involved. So in nerve damages, some very often the damage is in the spinal column, and it is extremely painful. It's excruciatingly painful. And usually, medically, it is recommended to go for an operation, but they do advise that there is a possibility that you may become paralyzed from the point of operation downwards, right? So there is that risk always when they operating the spine. So I had many patients who came to me with spinal injuries, to avoid going for, the operations, and the surgeries. And fortunately, the cases that were, presented to me, they followed my advice and they came for the necessary, because it required hands-on, therapy. Some therapies cannot be done telepathically. It needs hands-on, and they were able to and afford to move countries and come to me. And I was successful in removing that condition, and they no longer needed that surgery, and they were okay again, right? And extreme pain, especially nerve damage, in the joints where people are losing cartilage, and the nerves are grating against each other in your knee, for example, and the knee joint. It is extremely painful. Especially, this is a common problem with Muslims who are constantly prostrating and going down on the knees, and over the years and decades, it wears off the cartilage on the knees, and it becomes extremely painful on the knees. And I've every patient that came to me with that problem, so far, fortunately, I was able to reverse that, which means regrow the cartilage between the bones, with the healing therapy. So the natural healing therapy is amazing, and it is really remarkable, but it involves a miraculous energy that's not only from the healer, but it's also within every human being. So the healer comes in and he applies his energy, but it also activates the person's own healing energies as well, that contributes towards the healing, because the human has got amazing capabilities of self-healing, right? So it's not that someone is like a miracle worker and it's only he can do this. It involves you also, I would say The greater 80% of the healing comes from you, and only 20% comes from the healer who knows how to manipulate the energies and activating so that you can self heal. So, hope that information helps you. Take care of yourself always.